Okay. So now that we are recording, we're going to introduce our speaker. Kell Wilkinson is the Health Equity Lead here at the Allegheny County Health Department, and Kell will be discussing health equity and the social determinants of health. If you have any questions during the presentation, please feel free to note them in the chat box and we can answer them as they come. So now I'll pass the presentation over to Kell. Do you have access to share your screen, Kell?
Yeah, I'll share my screen in a minute. Sorry, I just got a call, so I had to like hurry up and hang it up. I hope they don't try to call right back. But anyways, yes, I'm going to go ahead and share my screen. So I'm going to do, it's PowerPoint Live, which is sometimes a little glitchy, but let's see if this opens up. If not, oh, do you see this? Am I good?
Yep.
All right, awesome. All right, thank you so much.
It looks black to me. Oh, there it's coming. It just had a delay. Great. Yep, I can see it. Yep.
Okay, great. Awesome. Well, thank you everyone for having me today and the introduction. Yes, my name is Kell Wilkinson. When referring to me, I do ask that people use they, them pronouns. And I am the Health Equity Lead here at the Health Department, and I sit within the Director's Office. So just a quick agenda of what I'm going to cover today. So we're going to overview social determinants of health and health equity. And then I'm actually going to provide a couple examples of some work that we're doing here at the Health Department, mostly from two CDC grant opportunities that we recently received notice of awards for. And then I'm actually going to open up the discussion for the collaborative where we can all kind of talk about examples of health equity initiatives, either happening within our organizations or maybe around us in our community. So go ahead. So here's just a placeholder slide. This is what we're doing. But before we get started, I wanted to ask folks just to kind of get some participation going and maybe for some of us to wake up a little bit. But think about, imagine you're moving to a new home, or think back to, prior to when you settled in your current home. What were some things that you considered when you were deciding where to live? And you can unmute yourself and suggest some things, or you're welcome to throw them in the chats. Schools, yes, very important. You probably want a decent school district around, hopeful that your kids will do well. Yard space, yeah, where to park. I mean, I have a dog, so for me, it was like I need green space. I, want the dog to be able to run around. Oh yeah, definitely walkability for a lot of folks is really nice. I see affordability, security, accessibility to work, being close to family, right? Safe outdoor space, safety, yeah. Proximity to parks. All right, awesome. Close place for exercise. Yeah, I completely agree with all of these. Thank you so much for throwing out some factors there that you consider when thinking about where you want to live. And that can launch us into a bit about, kind of understanding social determinants of health, right? So, where we lived often makes a big difference when it comes to access to things that we want and our own personal outcomes and how we do. I think also for a lot of us, it's important to recognize that kind of where we live is shaped by those around us. It's also shaped by policies that are around us that are created by institutions and developed and upheld, right, by like our neighbors and people around us. This historical context often structures how well we do in our life, how healthy we are in our communities, as well as how healthy and how successful those around us are. So, in thinking about social determinants of health, these are those conditions in the environments where people, where they're born, where they live, where they learn, like schools, where they work, maybe it's the health department or a nonprofit, where they play, like the parks that you mentioned, and how they age, right? Like this all affects a wide range of health, functioning, and quality of life related to different outcomes and risks. So in thinking about this, it's also important to remember that due to bias within some of these institutions and structures, you can see that someone's parts of someone's identity or where they live, or maybe their demographics like race or gender identity can be predictive factors in how well one does in their life. So here's the slide, shows you some examples, and I'll move over into just kind of like a quick slide so we can talk a little bit about equity and what that means. So equity really recognizes that each person has different circumstances and needs, right? So, and then different groups of people need different resources and opportunities allocated to them in order to thrive, right? So reaching equity, whether it's in our systems or in our neighborhoods, really requires closing some of those gaps so that for each individual, such things like their demographics or specifically where they live are maybe not protective factors for their individual success and well-being. And so now that we've gone ahead and talked a bit about social determinants of health and health equity, I'll take a moment before I go into examples if anybody has any questions or want to throw out sort of their own definitions of what they think about when they think about health equity or equity in general.
I just wanted to raise something, Kell, if it's all right. I've heard and I've read some, different academics, but then also professionals who are of the sense or who are of the belief that we should really add to the social determinants of health framework structural racism to that framework. And I've seen some newer writing about that. So I don't know if you've seen anything about that, or I mean, I've even seen some graphics that kind of show that. I don't know if you've seen, because you mentioned that as it relates to health equity, but that actually is a social determinant of health. So that's one thing that I've been thinking about a lot lately.
Yeah. And Hannah, I think you're really spot on there too, right? So when we think about kind of like the structures that surround us, whether it be like our neighborhoods, our work, or like the programs we access, I do think, it's absolutely important to think about, how institutions over time have like designed policies and programs. And I think, for a lot of us, it's become more important to recognize some of our own, internal sort of biases that we might have in navigating space. And often, sort of those individual biases, have an impact on how we design policies and programs, and thus, historically can become very rooted in the institutional policies in itself, which really does then create this system of structural racism. Exactly. Does anybody else have thoughts on that they would like to add? All right. Well, from there, and again, at the end, we can do some more discussion too, but I'll go ahead and launch in and talk about a couple initiatives that we have going on here at the health department that talk about, or where we are working towards improving health equity. So first, I want to talk about a recent award that the health department received through the CDC. So this is actually a a community health worker program. So this first slide is going to talk, it's a little wordy and talking a little more about the funding, but so this program was launched in August of this year. All of the CDC program around community health workers for COVID response was awarded through the CDC, but funded through the CARES Act of 2021. It's a substantial amount of money going directly back into communities to help employ and then enhance local community health worker networks. And Allegheny County is really proud to be one of the recipients of this award. So why community health workers, right? So as we all know, public health crises like COVID-19 absolutely can worsen existing health disparities that individuals and communities are challenged with every day. Community health workers as well are really those frontline public health workers who often are very well connected and trusted members of the community in which they serve. In that way, community health workers become, well positioned to reach individuals and communities that are hardest hit by COVID or other challenges within their communities. And that, the key there is really that trusting relationship that enables those workers to serve as a link between individuals to the health and social services that individuals might need in order to thrive. And we really believe that community health workers can help facilitate that critical access to service, and then in general provide the feedback that will improve service delivery as a whole. So a little more about the community health worker program. So the funding here is really related to addressing disparities that have arisen with COVID-19. So we do know that there have been disparities around who's getting tested, where they're getting tested, disparities around who is not receiving the vaccine. And so a lot of this funding will help us directly in communities talk about the importance and availability of things like testing and the vaccines, and also help us have a better understanding of how COVID is being transmitted in communities through contact tracing. Funding is also to address some additional factors that kind of increase the risk of severe COVID illness, such as some chronic diseases or maybe smoking and pregnancy. And the funding is also really intended to just, in general, try to address community needs that have been exacerbated by COVID itself. So, and some of these being, health and mental health care access, as well as things like accessing food. We've definitely seen food insecurity increase in our communities. So just a little more about what Allegheny County actually got. So this is a 3-year grant. In the first year, we've been awarded about $2.6 million. So yes, this is a nice substantial amount of money. I also think it's really important to show these numbers because we like to demonstrate that about 1.6, actually closer to 1.7 million of those dollars will be going directly to subrecipients of this grant. So this will be your local organizations in our community, whether it's like FQHCs, federally qualified health centers, or other community-based organizations. This money is going to allow some of those organizations to hire, 1 or 2 more community health workers to really get out in the community and do this type of COVID response and education. The other part, and there'll be training and curriculum development too, is kind of the other big portion of these dollars. We at the health department are really looking forward to developing more of this curriculum and messaging around it and getting it directly into the hands of community health workers and leaders. I know for me, even working at the health department, sometimes I get a little confused about like different COVID variants, risk factors and that sort of thing. So we're really excited to get as much information out there about COVID and how to respond to it as we continue to deal with this pandemic and probably will for a little bit into the future. So just like a quick summary of like our vision with the community health worker program here in Allegheny County. So we're really lucky that in Allegheny County, a lot of organizations already use a community health worker model. These are really evidence-based practices of using people, who live in their communities and are those trusted leaders to really connect people with services. So we're really happy that that network already exists and we're not sort of starting from scratch. But what we can do here is really think through how to expand and enhance that system, and also start thinking about ways to like centralize, support, and align these programs across the health department, across local community-based organizations, as well as healthcare organizations to really kind of like streamline and centralize information sharing that will directly impact the health and well-being of our community as a whole. All right, I think, yes. So here is just a few more slides on some of the other goals. So, just as a reminder, this will really create kind of like a unified training approach where we will be working with some area organizations to develop some pretty intensive curriculum for community health workers to go through to really understand a lot of pieces of COVID and how to respond to this pandemic. And it will create kind of like a centralized infrastructure for folks who already use these community health worker models to really lean on each other and connect around resources to better improve the community health worker system here in Allegheny County. And then here's a list of some of the community health partners that we are intending to work with. Again, this is we are starting our first year of a 3-year grant, and we do very much look forward to including more community health workers and partner organizations in year 2 and 3. But here's the list of a number of groups that will be working with us to start. All right. And then next I was going to talk about another grant, but before I do that, does anybody have any questions around the community health worker program or anything I can clarify?
Hi, I have a question.
Okay.
Who was eligible to participate in this program? What are the who's eligible to be a part of that program?
In terms of partner organizations,
yes.
Employing community health workers. So right now, this is our list of partners. And this list really started because early in the pandemic, we did already work with a number of federally qualified health centers and had already funded a number of community-based organizations to help us with contact tracing around COVID transmission. So this list really started from partners that we had already been working with during this last year and a half. But we do very much look forward to expanding this network in years 2 and 3. So we will be offering another request for proposals, hopefully in the spring, maybe summer, where we can allow for opportunity for more organizations to join us and help employ some community health workers. I will say though, the curriculum and like the training that we are developing, our intention, right now is to make that as broad as possible. So if you are at an organization, and I'll make sure my email gets into the chat, but if you're at an organization that would be interested in this type of curriculum, if you do have community health workers, I do absolutely encourage you to reach out to us, because we also have a number of like collaboratives and coalitions that are already building in Allegheny County. But we will utilize as part of this work to do information sharing and training, and we're more than happy to pull other folks into those opportunities as they present. So, oh, and it looks like, thank you for sharing my email. Yeah, it's kell.wilkinson@alleghenycounty.us. So feel free to reach out. But that was a really great question. Thank you. Any other questions?
I was just thinking, you know, if you could, like, going back to the beginning, just talk briefly about how, in your eyes, this connects to the work that the health department's doing as it relates to health equity and the social determinants of health, you know, and why, you know, these examples, you know, because it's, you know, you're kind of giving examples about how we're interpreting that work.
Yeah, that makes sense, Hannah. Yeah, and so, I mean, I think one of the things that's most important to recognize, right, is that, you know, COVID and the pandemic really hit some communities pretty hard, right? I mean, I think, you know, for some of us, you know, maybe harder than others, you know, but does that really matter? What we know is that certain communities have been hardest hit. Certain communities have had struggle accessing things like testing, things like vaccines. And sometimes like that access isn't even about the actual access of the test, right? It's all of like the education and understanding of why that is important. So, you know, I think that for us, like we recognize that sometimes the best way to like work with communities and address some of those disparities related to different social determinants of health, right? Like where you live, maybe some of your demographics, is to really employ folks who are already working directly in those communities, have a better understanding of, you know, what some of the challenges are, so that we can tailor programming and curriculum directly to those folks. Did that help, Hannah?
Yeah, thank you very much. I appreciate hearing that. Thanks a lot.
Mm-hmm. Any other questions on community health workers? And there'll be time later, and feel free to email me too if other things pop up. All right, so I'm going to switch gears a little bit and talk about another CDC grant that the health department was awarded in October, very recently. Really excited about this one as well. So the CDC this summer had published an opportunity for organizations to apply for what they call a Closing the Gap on Social Determinants of Health Accelerator program plan. The idea with this program was to select and award different localities with a little bit of money so that they could come together and put together like a multi-sector team and craft a plan to address certain social determinants of health in a specific population. So here at the health department, we ended up creating a proposal and a plan that focuses on improving health outcomes and reducing disparities for LGBT folks in our community. So here's a little bit more about our plan. So what the health department will do over the next year is put together this team to develop an action plan that will address social determinants of health related to health outcomes related to chronic disease disparities for residents in Allegheny County. In this year, through the collaboration, we'll develop an actionable plan with specific strategies that can be implemented to improve overall health outcomes. And with most CDC grant funding, you do have to select specific social determinant areas to address. And so for this program in and of itself, the health department selected looking at social connectedness, community clinical linkages, and tobacco use as our social determinant of health topic areas. And then quickly too, just wanted to provide a list of some of the partners that we intend to work with on this. So of course, we'll have a few health department programs involved and part of the leadership team. So definitely from our chronic disease and injury prevention program, as a lot of these health disparities definitely relate to chronic disease. We will also work closely with our public health clinic and HIV and STD program. And we'll also work with the REACH initiative very closely as well. We also recognize that for some of these areas, related to like social connectedness and mental health, we want to work with sister organizations like the Department of Human Services. And then we also recognize that there's a lot of community-based organizations and healthcare organizations out there doing some of this work already. And so we're really looking forward to partnering with them and drawing more linkages. The other thing I'll share about the funding for this one is that the health department was also very intentional about thinking through who we want at the table. And so we are still looking for recommendations for other community-based organizations to join us. And we'll be looking for community members themselves. And the point I wanted to make is that we are looking forward to compensating community members for their time and helping us, provide the feedback and the knowledge about what's going on in these communities in these areas and thinking through how to address them. And of course, we'll have the University of Pittsburgh will also conduct a process evaluation for us as well. And so that's kind of like a very quick summary of the Wellness for All team and future strategic plan, if you will, to address some social determinants of health and health disparities for LGBT folks here in Allegheny County. Also, Hannah was a co-lead on helping the health department secure this grant. So Hannah, if you had anything you wanted to add, feel free to do so at this time, but also wanted to open it up to the group if you have any questions about this latest grant initiative as well that's really directed at addressing specific health disparities for LGBT people in Allegheny County.
The one thing that I want to say is it was striking to me in doing research and working with Kell on this, I don't want to use the word intense, but the health disparities that exist in the LGBTQ plus community. And it seems to me, there's not a lot that's known, I think, just as it relates to data collection and things like that. So I think it's probably something that's well known in the community, but I would say more from like it's almost, I don't want to say hidden health disparities, but I just think that, across the board, with the limited information that we have, we need to shed light on and really, dig into some of the reasons why, because some of them may be the same as other communities that face health disparities, for example, folks with racial health disparities and things like that, but some of the reasons may be different. So I just look forward to this planning effort.
Thank you for adding that, Hannah. Any other questions from folks?
I think one thing that's not necessarily, may not be a question, but one thing that we were interested in, and I don't want to jump ahead, Kell, if this is jumping ahead, but if there are people on the call that know of other community-based or other efforts that are related to this addressing the social determinants of health or health equity, we were kind of interested if anybody would share those. And again, I might be jumping ahead, but would certainly want to hear from other folks on the call.
What was your question, Hannah?
My question, Kell has provided some examples of work that we're aware of, because it's work that is happening, with the health department's involvement. But if there are examples that you all know of, I'm sorry, I guess I was jumping ahead a little bit. Other community-based organizations or initiatives perhaps that your organization's involved in, just to share other examples of how people are addressing health equity and the social determinants of health here in Allegheny County.
So I'll put my camera on since I'm speaking. I'm Kiana Williams. So I work with two different organizations in the Pittsburgh area. I work with Allen Place Community Services and Gateway Medical Society. And both of those organizations do a lot of work centered around health equity. Allen Place particularly, they do a lot of work really focusing on seniors who tend to be an overlooked population in the community. So really helping with like food access, increasing that accessibility, especially fresh produce, where we know having access to healthier foods is really important for chronic disease management. So that's been a really big focus, and trying to mobilize the vaccines, having vaccine clinic on site actually November 18th, offering all three brands of the vaccine and the flu shots and the boosters. And we'll be able to do the vaccines for ages 5 and up too, which is great for those intergenerational families. And we really try to focus on that intergenerational piece as well, given that a lot of grandparents are taking care of their grandchildren. And then we have some other things in the works, but understanding that there's a lot of sexual health needs that are needed in those high rises with the seniors as well, that can sometimes go neglected. So we do a lot in that aspect from a health equity lens. And then Hannah's very familiar with what Gateway Medical Society does as well from a health equity standpoint, which also is very centered around mobilizing the vaccines, the flu education as well, and trying to really focus on reaching Black individuals in the Black and Hispanic individuals in the Pittsburgh area, which we know have been disproportionately affected by this pandemic in many different ways, especially with having an enhanced risk of having comorbidities. So those are some of the things we focused on. And this is, not to neglect any person that's within the LGBT community as well. So we try to keep everything very culturally relevant, with the messaging as well, so that it's very inclusive. And some of the messagings that we do include are more LGBT focused than others, but the predominant population all encompassing is seniors for Allen Place, but a lot of different work that's being done.
Thank you so much.
So we do still have quite a bit of time for discussion. So I would love to hear from other organizations in this collaborative. What are some initiatives that you have going on at your organization designed to achieve health equity?
Hey, Kell. This is Lisa.
Hey,
Ripper.
Lisa.
Hey, how are you? Good
Good.
to see you. Hi, everyone. I'm Lisa Ripper with Duquesne University Center for Integrative Health. We are one of the partner organizations for the Community Health Worker Program, and we're really looking forward to that. But in another example of an initiative here at the Center for Integrative Health that is designed to achieve health equity is a really cool program that we're running called Prescription for Change, which is kind of also part of the REACH initiative here too, but it is connecting folks with their community pharmacy to receive medication, therapy management, and chronic care management from a pharmacist, and then also provide opportunities for them to enroll in a chronic disease prevention or management class centered around blood pressure or diabetes. So I think that is a really great, well, it's an example of health equity because it is providing access to these classes and opportunities that folks in the communities in which we're working in might not have previously had that. And because everything is at their community pharmacy, it's easy to get to, it's accessible. And we've also connected folks with just access, like internet issues and Zoom meetings, which is where our community health workers have really come in handy to help us get people connected. So.
Thank you for sharing, Lisa. Here, I'll stop presenting as well so we can see each other a little better if that helps too.
I'm going to put Jim Whedon. It's another health department person, so sorry for talking too much. But he runs our Allegheny County Asthma Control Program, and asthma is a condition that's very much impacted by the social determinants of health. So Jim, I was just kind of hoping that you could talk. I mean, we have huge racial disparities, but then also some of the ways that some of our partners are trying to address that. Are you willing to talk about that?
Yeah, sure. It's interesting. We recently looked at some data, both at a state level and at the county level, and there are some very large differences between Black and white disparities, more specifically for kids. What we've seen in some of the data is that the younger the child is, the larger the chances are that they will have to go to the emergency room or be hospitalized for asthma-related asthma-related events. And one of the things that makes that really upsetting is that asthma is a controllable condition. It's something that can be managed very well. And we also are noticing this in various neighborhoods that typically are areas with lower SES associated neighborhoods. And what we're trying to do for as the Allegheny County Asthma Control Program is address these areas by going in and providing in-home assessments. So one of the big triggers is secondhand smoke. And we know that, people of color and are more likely to use tobacco products, which therefore influences their child's indoor air quality and really can increase asthma-related events or triggers. Also, just the quality or the living conditions of their homes, mold, indoor air quality, those type of things can have a big influence. Going to the doctors, that's another big one. So a lot of what the Allegheny County Asthma Control Program does is we try to provide education on the importance of using medications and using them as prescribed from their doctor. Also, how to provide some education on understanding various asthma triggers and when those type of things are happening. So, I know this is a long explanation, but those are some of the things that we try to do at the health department, is provide a lot of the education piece and, hands-on assessment and intervention to help these homes, become better living conditions for them. So just a long-winded example of how racial disparities are impacted even at an asthma level.
Thanks for sharing, Jim. Looks like we still have a little bit of time left too. So would love to hear examples from other organizations. Or also, if you live in a neighborhood or community where you see programs around you that are helping to close those gaps, even if it maybe isn't related to what you do at work, et cetera. But we would love to hear some of those examples as well of just things that are happening in our communities locally. All right. Well, it is about 1:15, so we can also end a bit early again today too. But what I will say is I'll make sure my email is at the end of the chat in case anybody has any follow-up questions. And I'll also stick around here for a couple minutes too. So if there were folks who wanted to chat about anything and felt a little more comfortable in a smaller group, I'll hang out for a few minutes.
Yeah, this was great, Kell. Thanks for the discussion. And maybe, Tori, if we do have our next Live Well Learning Collaborative in December about healthy eating on a budget, which is always popular. I don't know if there's a link you can put in the chat, and we'll send emails to folks. But Kell, really appreciate you kind of, leading this discussion and giving some examples. Thank you so much.
Thanks for having me.
Mm-hmm.
Looks like lots of thank yous in the chat though.
It's nice.
Yeah. Cool.
Yeah, thanks. This is great. Have a good day.
Yeah, and I guess you'll
Thanks,
upload
Tori.
the thing too, but the slides are, I think I sent you a collaborative link, so feel free to download them if you want them to, okay?
Oh, yeah, I can give that to Tori. Right. Okay, that sounds great.
Yeah, I can send it out. I usually do like a thank you email. So
Yeah.
Perfect. All right. Thank you so
thank
much.
you.
Have a
See you
good day.
later,
Bye.
Hannah.
See ya.
Bye.
Thanks a lot.
Bye.